15,000 nurses will vote to put patients before profits in a strike vote on Monday. It comes as nurses in the Twin Cities and Twin Ports are fighting for fair contracts to hold healthcare executives accountable. Here's what the president of the Minnesota Nurses Association, Mary C. Turner, had to say earlier today.
We're not asking for the moon. What we are asking our hospitals and our executives is to work with us to address our staffing, our retention, and our patient care in our hospitals. But our executives had made it clear they're not interested in taking on these issues. Even when a new study from the Minnesota Department of Health shows that adverse patient events are getting worse. Our hospital executives have refused to address these problems. That is why nurses last week voted no confidence in hospital executives. And it is why nurses today are announcing our plan to hold a strike vote this coming Monday, August 15th. We don't take this decision lightly. I and the nurses behind me and all 15,000 nurses want to be at the bedside, but we have been driven to this. We have tried to put proposals that would help to bring back the nurses to the bedside, but they're not interested. For the safety of our patients, we need to take this action.
We're taking this incredibly serious step because our petitions, our press conferences, our informational picket have failed to get the attention of our hospital leaders and decision makers, some of whom don't even live in our city or our state. They seem to have forgotten the most important piece of our healthcare system, the staff they need to work inside the building. We hope that we can reach agreements that attract the next generation of healthcare workers and retain our current highly skilled healthcare staff.
It is our duty to help our patients get the best care possible. Our integrity dictates we demand the kind of care that we would want for ourselves, our families, and our loved ones, for every single patient that crosses our threshold. We are asking our systems now to do the right thing for our patients and negotiate a fair contract for the nursing staff.
The strike vote comes after 5 months of negotiations with executives, and nurses have been working without contracts for several months. If the vote to strike passes, nurse negotiation leaders would be authorized to call a strike following a 10-day notice to employers. Stay with WCCO and CBS News Minnesota for the latest on this story.